I think there's a real issue about awareness of extra care housing. A lot of people see housing as being completely separate from health, and yet we know that housing can have a big impact on people's health. And I think by having the right living environments, the right housing environments, we allow people to be more in control of their own health and well-being, but also we allow them to prevent some of the crises that might otherwise happen.
So we have got examples where we have step up and step down facilities within our extra care schemes. The people from the CCGs that can commission or can bring somebody out into one of our schemes from hospital that maybe not necessarily need hospital care, but there's nowhere else for them to go because their home isn't suitable, or they do need just a bit more support to enable a bit of rehabilitation. It's a great environment for people to come into.
I mean, my husband was bed blocking for about 4 months because he couldn't come home here and they couldn't find anywhere for him to go. And I was aware of that, but there was nothing I could do.
We do struggle as much as we try to keep people out of hospital, but unfortunately if there's no package of care to support them and there's no community hospital beds, they do bounce into an acute bed.
Increasingly we're able to engage with our health colleagues to just identify whether actually a housing solution might mean that the difference between someone having to have a health intervention or going to hospital or not. We are jointly funding a health and housing coordinator post at the local hospital, and the idea of that post predominantly was to look at people who may be in hospital longer than they needed to be, to try to identify a range of solutions, and Homebridge is just one of those. The idea of Homebridge is it provides this short-term provision where somebody can come here, there's some care on site, and they can feel safe. You know, people feel much happier.
To go home to an empty house with nobody really to make sure it's warm for them or that there's bread and milk in the fridge. And I think this is why this is such an exciting concept, is actually to try and bridge some of these gaps for people, to stop them before they actually need care packages and keep them as independent for as long as possible.
My limits are hidden because I've got epilepsy and I've got brain damage. They found me in the bath unconscious and they had to call the ambulance, and I woke up in St Thomas's in London and didn't know how I got there, you know. You do get go into a sort of like a dark place sometimes, and you think, what is going to happen to me and that sort of stuff. I came down here not expecting this, you know, because you never know, do you? They might drop you off somewhere and it might be awful, but you know, I turned up here and I thought, oh God, this is nice. So I was very pleased.
We often find that people feedback that they're quite surprised when they come in. The quality of the scheme, the space that's available within the individual flats, that give people that sense of, yes, I could come and live here, I could successfully live here and not feel like I'm in a home.
We see it a lot of the time. We get medical professionals who come in and say, we didn't realise that it's nice here, you know, it's nice here. And it's like, okay, so what did you think of it? Oh, we were not sure what we thought this was. When they walk in, they think, wow, this is different.
An advantage as well of getting people out of hospital, which isn't a suitable environment for a lot of people, and certainly not for an extended period of time. It also gives them the opportunity to almost try before you buy, in that they can experience life in an extra care scheme, which is quite different to the life which people may have had. So we're always looking at ways to innovate, to actually promote the extra care model and its potential advantages to the health sector in particular.
What works really well in Lambeth is we've got a very closely integrated team, and our extra care service is one example of that, where that's worked really well. We've now got 7 extra care schemes in Lambeth, and they're all jointly commissioned with health and adult social care. So we are able to take full advantage of the opportunities that extra care offers. And aside from the financial benefits, I think there's just these opportunities for closer working and realising each other's objectives.
Quite often in health and social care, we deliver a service that actually isn't what the person really wants. We need to move the question from always being about what is the matter with a person and making sure that we never leave the room without asking, and what matters to the person. And our determination with our ESTA philosophy of care is to break down the organisational and professional barriers so that we can start to look across those organisations and professions.
In the past, I've probably been a lot more prescriptive, where you go in and you'll see somebody and you think, they need A, B, C and D. But now I actually take a step back and you actually think, what do they actually want? It's maybe not about what the person needs, but more about what they would like to have happening in their life. And I think it's looking at things differently.
I started nursing when I was 17 and I'm in my 40s now, and I'm thinking, you do become quite restricted in your way of thinking, and so by networking with other people, it's opened up a whole new way of thinking, and that anything is possible and that we can work differently and we can actually rely on other people to support us, not just qualified nurses.
It's turned out to be a lot better than I thought it was going to be. It's a lot more like being at home, to make you fitter and realise how much you can do.
I guess there's a real message there to health and social care to actually invite housing to the table. Just so they can understand the role that housing has to play, and so that housing gets as much prominence as health and social care. It is as important as those two, but that importance isn't realised at the moment.